Hi, I'm Dr. Anna Saylor with Every Family Chiropractic Center, located in Royal Oak, Michigan. And today we have Dr. Marissa Heisel from Spines and Minds in Hanover, Ontario. And we're going to be talking about making over your medicine cabinet with essential oils. Welcome.
Thank you.
So tell me a little bit more about what we can do. We all have a medicine cabinet filled with stuff.
Filled with stuff.
Mm-hmm. And what can we do to make our medicine cabinet a little healthier or a lot healthier or 100% healthier?
I think one thing that we can all agree on is that we probably are all looking for safer, cheaper, more effective medicine. And I think a lot of that emphasis needs to be on safer.
Okay.
You know, pharmaceutical medications often derive from plants, but they do something that's called fractionating. They'll take the most potent chemical compound in a plant, they'll pull it out, and then they'll recombine it with an awful lot of things, fillers and chemicals that when recombined all have side effects in the body.
Okay, so stuff that's not good for you.
Stuff that's not good for us.
Okay.
You know, the leading cause of death in North America these days is actually drug interactions.
Okay.
And we're talking legal drugs. We're not talking anything illegal. We're talking drugs that interact with each other, often in hospital. And these are often prescribed drugs, and they are the leading cause of death right now.
And the number is probably higher than we think it is,
It's substantially higher
Okay.
than most people think that it is. And we really need to stop and look at that. We need to look at all of these side effects and recognize that they're really contributing to our ill health.
Because we are not an overall healthy society.
We're not.
Okay.
You know, the United States spends more money on healthcare than any other country in the world and ranks about 54th in quality of healthcare. That's really problematic. If you had a CEO of a company that had those kinds of statistics, they'd be fired.
That's very sad.
It is sad, and it's something that we can do something about.
Great. Tell me more.
There are a lot of different aspects to that. You know, one of them really needs to be nutrition. It needs to be the foods that we're eating, what's sprayed on those foods, how those foods are modified. And all of those things have a direct effect on the health of our body.
Okay.
They introduce heavy metals sometimes. They introduce chemical reactions in the body. And unfortunately, research, if you look at different countries, demonstrates that those can be really harmful to our health. When you bring in financial interests,
Right.
sometimes that's not demonstrated, but we have to look at the fact that our children are getting sicker with chronic illnesses that used to be illnesses of the middle-aged and the elderly.
Okay.
And from an evolutionary point of view, we haven't changed in thousands of years.
Not much.
No, very little.
Yeah.
And so it's not that we've changed, it's that the environment that we're situated in has changed. And there are a number of factors in that. Part of that is the air that we're breathing, the food that we're eating, the fact that our children think that a diet of fast food and soda is normal. You know, we have to differentiate between what's normal and common and what's natural. It's not natural for kids to have shingles. It's not natural for kids to have type 2 diabetes. Those aren't illnesses of the young age, and yet they're occurring more and more frequently.
And much younger ages, too.
Substantially.
Right.
Yeah, substantially younger.
Okay.
The concern is that as those children get older, they're not going to have the internal reserves, the immune system, the health that they need in order to then work through issues that come up as we age.
Okay.
And so we've got a population that's sicker at a much earlier age than we ever did before. We need to look at how to address those.
Okay.
One thing that we can look at is the food that we're eating. You know, what we're putting into our children's bodies has a direct effect on the quality of what their bodies are able to produce. It's kind of a garbage in, garbage out. You know, so that's one aspect.
Okay. I have 2 young children, and I can honestly say they've never had French fries. And a lot of people think that's actually really unusual. But, you know, garbage in, garbage out. So
My children have never eaten at fast food restaurants. Same thing. They don't drink soda pop. And to some people that might seem as though I'm being completely unkind, but I know that my kids don't have the illnesses that other children get. They've never taken antibiotics.
mine either.
And we have to look at, that's not luck.
Yeah.
You know, that's not
No.
dumb luck. That's a measure of how they eat. That's a measure as well of adjusting them on a regular basis. And when my kids get sick, they ask for remedies. They ask for oils. And sometimes they get, you know, supplements or vitamins.
Okay.
And I've traveled internationally with them quite a bit in countries that people will often get very ill, and it hasn't happened because we're very strict about what goes into their bodies.
Which is actually a good thing. You're keeping them healthy.
And that's the end goal, is to keep them healthy. You know, prevention is going to be key, especially as things continue to compound in our environment. We can't just look at treating after the fact. We need to look at what is at the source of illness and how do we prevent it from occurring in the first place.
I think society, we're very much, you get something, you get sick, and you go and try and treat it.
Right.
Where what we're doing here is trying to prevent it.
And I'm very grateful for Western medicine when there is an emergency, when there is an illness that really requires that kind of consultation and clinical evaluation and sometimes pharmaceutical medication. But that should be a last resort and not a first resort.
Okay.
And so what we want to do is we want to look at the environment. The environment in our homes. Even if we can't control the external environment, we can certainly look at what's going on in our homes. We can start with cleaning products. You know, if we're buying commercial cleaning products, they are completely toxic. And the idea that we can spray those things on our tables, clean our floors with them, clean our countertops with them, and not have any sort of effect on the human body is a complete fallacy. It's a fairy tale. It gets into our air, it gets onto our clothing. We want to look at things that we can use. So microfiber cloths and water are brilliant. Vinegar is amazing. Using lemon oil and water is amazing at cutting grease and grime. And we don't need to look at something that's a chemical compound then that will induce illness or potentially cause the immune system to function at a lower rate. So that's one thing that we can start with.
Okay.
The next one is then again going to be food. I can't say that everyone should eat organic food all the time. That's not a realistic expectation. And there are the naysayers who say that even organic food has sprays and compounds that come from other farms. And it's true. We can't guarantee that anything is 100% organic. But we can certainly try to do that more often than not.
Right.
To make sure that the food that our children is eating is as clean as possible. To make sure that the meat that they're ingesting hasn't been complicated by toxins, by hormones, by steroids, because what goes into our bodies is going to essentially form the proteins and the neurotransmitters that our bodies work off of after that.
Okay. So what else can we do to make over our medicine cabinet? What else can we do?
We can start looking at all the things that we normally find in our medicine cabinets and start replacing it with holistic, botanically based or plant-based products instead. So for example, mosquito repellent in the summer.
Okay.
You know, we talk about DEET all the time, and we talk about why DEET is necessary for things like West Nile virus.
Right.
The reality is it's not a very common occurrence, and DEET is a neurotoxin and a hormone disruptor. We spray it all over our children in ever-increasing quantities and dilutions, and in order to prevent the possibility of a fairly remote incidence, we're really affecting the health of our children. And so using an essential oil that's specifically blended from a number of different oils that will naturally repel mosquitoes is one thing that we can do. And using essential oils can be used both as a repellent and for an afterbite. For itching. That would be one thing.
Tell me a little bit more about that. Like, how would you apply it? What would you apply?
So you would want to look for something that's a blend instead of just applying one or two oils.
Okay.
And there are different blends that are specifically for bug bites. And you'd want to apply it topically. It's never something that you would ingest. It's something that you can either pour into your hand and apply or put into a spray bottle and spray onto a child.
Okay. Once again, I'm Dr. Anna Saylor, and we're talking about essential oils today. And we're going to take some questions from the audience.
Besides using chiropractic care for our children and for myself, which has been fantastic, as a mother of four, are there certain oils that you would recommend to use on top of what we're doing? And what kit would you recommend would be a fantastic kit for that?
So with general family health, there are specific things that you might want to be looking at. One thing that you want to think about when you're using essential oils for therapeutic purposes is different tools that you can use. So one of them would be a diffuser to have in your home. One of them would be some sort of an all-natural carrier oil. That could be, as we've said, olive oil. It could be coconut oil. you'd want to have some sort of capsules that you can put some of the spicier oils into. And you want to have some tools in terms of resources. There's this book, for example. It's called Modern Essentials. And it's a book that you can pick up and look at anytime that you want to see what different oils are for, what different blends are for, and also what can be used with different situations or different conditions. But in terms of specific oils that you might want to use, you'd want to be looking at something that would be helpful for digestion. That might be peppermint. That might be something that's more of a blend of different oils like caraway and ginger and fennel and peppermint. You'd want something that was really helpful for respiratory health. So if a child or if somebody else in the family had a cold or a flu, if anybody in the family has asthma or bronchitis, then you might want something that was a respiratory blend that you could put on topically in order to help with easing the function of the lungs. You'd want something that could be helpful for allergies, for example. Combining lemon, lavender, and peppermint in a little bit of water and then drinking that internally is a brilliant counterpart to using a medical or a pharmaceutical antihistamine.
Would you do that daily? On a daily basis?
For allergies?
For allergies?
It would really depend on whether you're trying to treat or you're trying to prevent.
Okay.
So if you've got somebody with chronic allergies, it might be really useful to have, to put together that blend and give it to them every morning and potentially every evening. But the other way to use it would be as needed, that you can take it at that point if something was acute. Something else that I would look at would be inflammatory. So oils that you can look at for muscle and joint pain.
So tell me a little bit more about essential oils and the applications and what else we can do to help.
So essential oils are an incredibly potent plant-based medicine. In fact, they're about 50 to 70 times more powerful than their herbal counterparts.
Okay.
And so you really only need a drop or two of any oil that you're using for therapeutic benefits. There are 3 different ways that the oils can be used. They can be used aromatically, in a diffuser, or even just held and wafted under the nose. That will create benefits in both the respiratory system and often have very significant mood management responses. So uplifting or decreasing depression. They'll actually cross into a part of the brain called the amygdala, responsible for mood and emotion and memory. And sometimes some of them can cross the blood-brain barrier and affect a direct neurological change. You can also apply them topically. So if we're talking about something like bug bites, you might want to apply an essential oil directly over the bite. If you're looking at something like a burn or a skin wound, you might want to be looking at melaleuca, which is a tea tree oil, or lavender, which is a very gentle oil that helps with wound healing, with tissue repair. And then the last thing that you can do if your oils are pure is that you can ingest them so that you can use them for direct therapeutic benefit.
Wonderful.
And that can be beneficial with something like abdominal health or cardiovascular health.
So by ingesting, do you mean like a drop under your tongue, a little bit in water? It really depends on
any of
your
the above.
taste. Okay.
Yeah. Some of them are quite spicy and some of them are a little bitter. And so putting it directly into the mouth might not be something that you would want to do. But in a little bit of water in a veggie capsule that you can open up and pour the oil into, that can be extremely helpful. And you can use them in that way as though they were a therapeutic medication.
Okay, because anything that gets in your mouth sublingual is going to really get into your nervous system, get into your system really quickly.
It's going to get into your system very quickly.
Through the skin, through the mouth, those 2 things.
Exactly.
Okay.
And again, if they're used aromatically, if they're diffused into the air, there's an immediate response in the brain. The olfactory system has the fastest response time of any of our senses, and as soon as we smell something, it causes an immediate effect.
Okay, so let's talk about the number one thing that people know about is antibiotics.
Right.
You know, it's in a lot of people's medicine cabinets.
It is.
So what can we do specifically? What kind of oil could we use? What could we do to not so much replace, well, I guess prevent antibiotics?
So one thing that people don't necessarily realize is that antibiotics are only effective against bacteria. And bacteria sit outside of the cell. They sit in the extracellular fluid. And so when the antibiotic goes into the body, they can essentially find and eradicate the bacteria that might be in there.
Okay.
But the problem is that it gets rid of all bacteria, both the good and the bad. Our bodies are constantly flooded with bacteria that it uses to help defend us against other pathogens, other things in our environment. And as soon as you wipe all of that out, you cause the gut to be incapable of helping us to fight off other bacteria in our environment.
Okay.
So what you'll often see is somebody who's been on antibiotic therapy getting sick again fairly rapidly because their immune system, it just isn't capable of recognizing or fighting off that new infection.
Like a yeast infection, we see that a lot.
You'll see a yeast infection after antibiotic therapy because the good bacteria in our body has been wiped out.
Okay.
But what I'm talking about as well is the introduction of a new bacteria into our body that will actually cause a super infection or an infection on top of the previous infection. And that's where you start getting into danger, where you start seeing multiple courses of antibiotics given. And when the first one doesn't work anymore, there's a new one that's introduced. I've got kids in my practice who have been on multiple courses of antibiotics for ear infections. They finish one, 2 weeks later they've got a new ear infection. They finish that one, then they're given another antibiotic. Sometimes they're given prophylactic antibiotics for 6 months at a time, trying to keep them from getting ear infections. But all that's happened now is that we've wiped out the good bacteria in that child's gut. Okay. One of the big issues with that is that one of the primary neurotransmitters that helps with mood, called serotonin, is processed in the gut. When we don't have that good bacteria anymore, we can't produce or process serotonin appropriately. I used to see kids in the practice who had multiple ear infections, and by the time they were in senior kindergarten or grade 1, they were having some significant behavioral issues. Right. And those were being investigated as ADD or ADHD. What this past year has shown is research that's coming out that's linking serotonin levels in the gut with oppositional defiance and behavioral disorders. And all of a sudden, you start to see how A leads to B leads to C.
So you're treating one infection and it's leading to a whole other amount of symptoms.
It is.
Okay.
It is. And so what we want to do is find other ways to treat both bacteria and viruses. Again, antibiotics will only address the bacteria. Viruses live within a cell. And the way that they work is they essentially hijack our DNA, and they cause a replication or a reproduction of our DNA, but in an altered state.
Okay.
Antibiotics can't get into the cell, but essential oils can. Our bodies recognize them as a natural product. They can recognize the chemistry of the oil, and the oils can get right into our cells in order to produce both antibacterial effects outside of the cell and antiviral effects within the cell.
Okay.
That's how the oils can be as effective as they are against things like MRSA, against MRSA, against things like chickenpox and mono, because it's very difficult to treat some of those infections using conventional pharmaceutical medications because they have limited applications. But as soon as you can introduce something into the body that the body recognizes as something more natural, the body will accept it more readily. You know, we need to look at whether the body can recognize the illness. Can it recognize the medication that's been introduced? Can it utilize it appropriately? And then, what are the side effects from that?
Right.
From pharmaceutical medications, there are unfortunately a huge host of side effects, including accumulation in the liver, sometimes liver damage or kidney damage. And again, we lead to secondary effects and more illness after that.
So tell me a little bit about the side effects of an essential oil.
You know, tongue-in-cheek, we talk more about side benefits than side effects.
Okay.
Every oil has both physical properties that it induces and emotional properties that it induces. So we've talked a little bit about some of the reference materials that can be really helpful to have in your home. One might be a book like this, which is called Modern Essentials. Okay. And in it you can learn about each of the individual oils, the blends of oils, and different symptoms that the oils can treat. And then there's a secondary book.
This one, Emotions and Essential Oils.
And if you look at that one, they'll talk again about the individual oils and what the emotional effect might be.
Very nice.
So while something like wild orange is a detoxifier, it's uplifting to the mood, from an emotional perspective, it induces senses of joy. It's an oil of abundance. And so there's a certain happiness and uplifting that comes with that.
Okay, because we're both chiropractors, and we both practice with essential oils. We both adjust with essential oils, and I know from personal experience that, you know, when we're adjusting a patient and we're using the oils, it just changes the overall mood, and it just so much more calming and well-being and balance. And so it really, I feel like it really gets into the cells, like you're saying.
It does, and you and I know both practice very similarly. I love, when people tell me that they're going for talk therapy. But sometimes there's a plateau that's reached. And what people really need to do is get back into their body in order to find those sources of deep pain or deep memories that are really creating and perpetuating not just emotional but also physical conditions, physical and emotional pain that people are holding.
Okay.
We need to get into our body and find those areas, those memories, in order to release them. But what I don't want somebody to have to go through is a re-traumatizing or a re-victimization, potentially, that might occur when a memory surfaces. What I love about the oils from an emotional perspective is that I can use them to help somebody release an old pattern, an old memory, an old wound, without having to relive the trauma of that.
So with an essential oil, let's go back to the making over the medicine cabinet. A lot of people know things like Xanax or Valium or the drugs that actually are helping with depression or the mood stabilizers. Tell me a little bit about what we can do for the oil, what else we can do.
In terms of mood specifically?
Yeah, just a little bit about what we could do to get rid of the Xanax or the Valium.
So there are different things that oils will do. Some of them will cause more of a sedation effect. They'll be calming. They'll help with sleep. They'll help with insomnia. They'll help with that sort of hyperactivity that can go on. And some of the oils will have the opposite effect. They'll be uplifting to the mood.
Okay.
And it really depends on what you're looking at. And oftentimes when you're looking at something like mood management, you really want both at different times. People will be really struggling sometimes with extreme worry and anxiety, at other times with feeling extremely grief-stricken or low, and you want to be able to find oils that are useful for each of those.
Thank you for joining us today, and I want to thank our guest, Dr. Marissa Heisel, for joining me and talking about the benefits of essential oils.